Good morning and welcome to this episode of questions and answers on medical surgical nursing. If you follow the series of tutorials in this channel, it's going to help you to learn better and prepare well for your exam. So you are going to pass your exam at the first attempt. Today we are starting with respiratory system. The modality of this tutorial will be in form of questions and answers, whereby we'll discuss scenario-based questions. I'll go into details to explain what the question means and also to explain the rationales for each answer. Question 1 says, a patient with acute asthma exacerbation is using accessory muscles and has difficulty speaking in full sentences. What is the nurse's priority action? A. Administer a short-acting bronchodilator. Obtain a chest X-ray. C. Start IV antibiotics. D. Encourage oral fluids. First, let's understand the question. What's acute asthma? Acute asthma is a disease condition that causes the airway inflammation when exposed to allergens like pollens, drugs, dust, cold, and so on. When there is airway inflammation, this leads to excessive secretion of mucus in the airway and also the constriction of the bronchioles. The constriction of the bronchioles leads to the blockade of the mucus, leading to reduced level of oxygen that gets to the lungs. So the patient responds by using the accessory muscles just to increase the amount of oxygen that can be taken into the lungs. What are accessory muscles of respiration? This includes pectoralis major, pectoralis minor, abdominal muscles, and internal intercostal muscles. So these are used to exert extra effort needed to increase oxygen level that gets to the lungs. So the question says, what is the nurse's priority action? So here we understand that the patient is in an emergency situation that requires urgent intervention. So we use our ABC principle, which stands for airway, breathing, and circulation. So based on that, the correct option here should be administer a short-acting bronchodilator, which focuses on dilating the airway to increase oxygen level in the lungs. So what are bronchodilators? Bronchodilators are the drugs that are beta agonists. They increase, they expand the airway by increasing the diameter of the bronchial pathway, leading to increased level of oxygen that gets to the lungs. Examples of bronchodilators include salbutamol, terbutaline. These are short-acting. We also have long-acting bronchodilators, which include salmeterol. But the right drug to offer here is a short-acting bronchodilator to relieve the patient of the bronchial constriction and relieve the acute asthma. Thank you.